One more common scenario is burns. So we see a lot of burns cases, and someone asks them to put on the ice or put some water, or even some people put some milk. They will wrap them in a cloth or in paper. So we want to hear from the expert on the burn injuries, how to
The
handle
first
the
aid.
burn injuries.
First aid for burns actually. Sir, burns is a very huge topic. Burns can be because of many things. So one is fire, which is more common, which we see, and second most common household item is hot oil. Okay, and the third most common is hot water.
Okay.
So when what we see is they'll carry the baby in the arms, and then they'll carry a hot item in another hand, and they'll be going. Baby will not stop still, so he'll put his hand in the hot things. So we see burns of the hands. Another is they are boiling water for the kids, and they are carrying it. The baby suddenly comes into your legs, and you tend to spill it on the baby. That is another thing. And without testing the hot, you can put in the baby in the water. So these are the baby, regarding the baby. And other main things are hot oil. When you are cooking, so what you want to do, you want to switch on the stove, make the oil heat, and then start cutting this. So you are in a hurry to do things. So you just splash it. The all hot oil will splash on you. So this particular ways you get exposed to the fire. And the third most common which we see is the cloth getting in the deepam. The cloth, or what the edge of the cloth gets fired, and then it spreads onto your body during puja, and especially when you are having a puja in the closed room, and then and then other fire is like burning yourself with the suicide. So this fire can be because of any other substance, can be kerosene, petrol, or oil, or anything. So it depends on what type of thing you are exposed to, and how much time you are exposed to, and where you are exposed to defines your damage for burns.
Okay.
You understand, sir? So if it is a petrol burn, on one type of temperature it can gain. If it is a kerosene one, it can gain up to one temperature. If it can oil, it can come one. If it's cloth, it can gain up to one temperature. If it's another gas, it can be another temperature. So it depends on how much temperature it can attain and how much damage it can do on your skin.
Yeah,
Instant
depending on
damage.
the temperature, the damage
The fire,
is assessed.
yes, the fire, especially the fire, the temperature it can reach, that will damage your skin or the organs. The heat you inhale can damage your whole respiratory system. Eyes it can burn, hair it can burn, face it can burn. So it depends on the fire, the amount of fire, the time of exposure. Is it instant or is it longer time? And how much extent on the body are you getting affected? If it's a chemical burn, how much chemical spillage on your body? Once the chemical is spillage, how much time is it in contact with you? Was there any cloth in between, or only on the skin, direct skin? So the amount of injury is always estimated with these many factors. It's not a single, okay, I have got a burn, no, it's not like that. Each burn has a different type of first aid. Look, chemical burns or acid and alkali burns are usually very problematic. They burn instantaneously. They damage your tissues instantaneously. The best way is to just put your hand under the tap water and clean it off. That's the first step you can do. First step you can do. If it burns, just put some ice on it, so that it doesn't hurt you much. But once you clean off the thing, if then there is no more acid or a chemical which is hurting you, then you can start putting ice or cream or milk or whatever household things if you want you can put, as long as you are not contaminating the wound. Okay, so you can do whatever it is just to relief. That is only for a pain relief. It doesn't treat the burn. It doesn't make it go away. If it is a fire burn, so you have to put it off fast. As I told you, the contact time. How you are putting off is doesn't matter. So you have something in your hand, cloth or something, put it off, because the problem with the cloth is it sticks to your skin once that is off. So it's very difficult to remove. The skin comes peeling off. So water is better thing. Just pour the water, because that means you are stopping the ignition agent. That means the firing source. The firing source here is either oxygen or the fire, the fluid, the liquid itself. So once you remove them, once you put off the oxygen, there is no source of fire, so fire gets controlled. So that is source, put off the source is what we say. Okay, so once you do that, you stop the exposure. That means you already stopped half the damage. So whatever the damage has happened, so there is nothing much you can do at that particular minute. So give them only pain relief is what we see. So even if you come to the hospital, what we try to remove the exposed material first, and then try to assess the wound and other, then we can start treatment to the patient. And there is nothing much you can do about burns at that particular moment when it is happening, sir, apart from stopping it and preventing it. Of course, preventing is the first step. So when you're in your home, if you're cooking, stay a little far and then cook. Don't do it in high flames, and you should know what you are doing.
Be careful when children are
children are around. And even if you want to warm the water for children, why do you want to make it super hot boil? Okay, so make it just warm and then bathe with them and put them in another room when you are doing this one. After this is done, then you can bring the baby. Always test it on your skin before you give it to baby. Even milk, when you boil the milk, always test it on your skin and put it on 1 or 2 drops and see if it is warm or hot. Then feed the baby, and that, because it's very important that you don't give extreme temperatures to kids. So it definitely hurts them a lot. And when you're cooking at home, open your windows and don't do in a closed room. So that when you open the windows, even if the gas leakage, it goes out rather than stays in one single room. So if you smell gas leakage, don't plug on this thing. So these are the basic precautions and first aid things you can do for burning.
And one more common thing Indians do, no other person in the world do it, keeping turmeric onto it. So what's your opinion on putting some turmeric onto it?
Sir, as an allopathic doctor, I don't advise turmeric to be kept, but it is one first of known antibiotic for us from ages. So there is no comments on it as such. Okay. But for me, if I am receiving a patient with a turmeric on a wound, it is very difficult for me to clean and do a first aid for that particular wound. So
to tell it straightforward, don't keep it.
Avoid keeping it.
Okay. Yeah.
I won't say don't. I just said avoid.
Yeah. Great.